Hi there. Today we're going to talk about life-saving priorities. Uh, my name is Ev Zervadakis, and I'm the founder and president of Private Patient Advocates Incorporated. And today we're going to look at some of the priorities that need to take place to protect you from uh, grief, extra work, and um, a lot of time. First thing I always say is we need to have our medical directives in order. And that's a form that you fill out to say, this is what I want, this is what I don't want. In other words, you may not want to be resuscitated, you may want to be resuscitated. Make that very clear. If whatever you want, and the form is very self explanatory, just get it in writing and then give a copy to your healthcare providers and give a copy to a family member. And anytime you go to the hospital, make sure that is on you, or make sure that people know that you do have one, so that way it will be adhered to. Very, very, very important, because especially for children. Let's say you have a child that's over the age of 18 and something happens to them, a horrible accident, and you're there. You can't speak for them legally. You have to have some kind of paperwork, this kind of paperwork all lined up. So it's very important to tell your adult children to have you written down as a parent, as a person of contact that could get give advice or give the medical directives, like this is what my mother would have wanted, this is what my father would have wanted, or whatever, or vice versa. So I hope this all makes sense, but that's one of the things that we recommend, is the advanced medical directive, and also to tell the doctor that these are the people that have access to the medical information on the chart. The other thing that's very important is your list of healthcare providers, name, address, and phone numbers. So that way, everything is transparent. Everyone knows, and if anything were to happen, we all know that this is your cardiologist, this is your sleep doctor, this is your psychiatrist, this is your all the examples, and this is where you get your mammogram, and this is your diabetes doctor, your heart doctor, all the different doctors that you use. You list them, you have it all organized, and also the facilities that you may use, like where you go for a mammogram, where you go for X-rays, because that is all very important for the next step, which is a list of your insurance policy and what it entails. You should know your policy very well, and you should always have that accessible. So if you need to look something up, you know that it covers this, it covers that. It's not covered in this state. If it's out of network, in network, some of the words that you have to know. Also, you have to know what your copay is, what your deductible is, and your coinsurance, if you have any. Now, if you have Medicare and another insurance, supplemental insurance, then you have to know how they work together. It's always a great idea to call the insurance companies before you go in for either a doctor's appointment or a procedure, just to make sure that you're on the same page, because the doctor's office doesn't always know what exactly your policy covers. And when you sign all the paperwork and the disclaimers in the doctor's office, they do say that you are responsible for the understanding of your own policy. So, yeah, sometimes, you have to be reasonable. It's your insurance. So it's up to you. It's your responsibility to make sure that you understand what is covered, what isn't covered. Sometimes, if you get a procedure done 3 days before the day that they tell you. It might be like you have to wait every year. Well, they're very funny about that. It's 365 days. If you're 3 days early because that's when the appointment was scheduled, it may not be covered. So little things like that, these really tiny, minuscule details are so important, excuse me, and it will save you a lot of time and money because if you work with the system, you know the rules of the game, you're going to win the game. The other thing that's on my list is a list of drugs. I've seen so many people uh, take so many drugs that they need, but then when they review it with the pharmacist, they find out that they actually have 4 drugs for their heart. So that needs to be clarified. And do they indeed need the 4 drugs for the heart? And so many times it's because the wires get crossed and those 4 drugs were necessary at one particular time, but then the other 2 drugs should have been discontinued or not continued. And so that had to be clarified. So it's really up to you to make sure that you understand. You have to be very proactive with healthcare. Um, Doctors are very, very busy. They do a great job taking care of us, but we need to help them. And part of it is to be proactive and responsible. You need to give the doctor all the clues. They have to make sure everything goes into the system. So we are here to help you get the best care by being proactive again and to tell you how to be proactive and to give you some guidelines and what's very important and what can you let slide. So drug interactions also is very important. Every single one of you should be looking at the drug interactions for each medication that you take because it may be showing up and causing a problem that maybe you're taking another medication for that side effect and then it cascades down and you could be on 5 medications because that initial medication was not really the best fit. But if you don't tell your doctor all the symptoms and signs that you have when you take a medication that is not working ultimately for you, then that's something that we need to look into. And that's one of the things that I help you do. The other thing on my list is, oh, yes, always go into your set up the patient portal. It's really good. And especially now with this pandemic and the telemedicine, it's a really great tool. You don't want to be running to the doctor every 2 minutes if you don't have to. Use the internet. And if you need help setting that up, I'm there to help you do that as well. So make sure, excuse me, after you set up the teleporter, I mean the health portal, the patient portal for your health, make sure that information is correct. You'd be surprised how many little things are wrong, or just old information and things like that, or you're single but you're not single, or there might be a digit off on your address or your phone number or on your kids' phone number if they're part of the family member list. All that is critical. So it's always good to update it during your 1 year, every year annually, update that. So I hope you've gotten a really good understanding on the different things that you could do to prioritize your healthcare uh, documents and information to save you a lot of time, money, and grief. And give me a thumbs up if you like what you hear. Share this with other people and let me know who you are. And if you have a question, you could private message me. Let me know where you live. I'd love to know that. And I'll continue to tell you more stories. I love your feedback. I try to keep these videos under 10 minutes. So I'm at 10 minutes and 10 seconds. And oh, yes, one last tip. Never, ever, ever carry your Social Security card on you. Make a copy of it and carry it around with you. But if you lose that original Social Security card, it's such a pain in the neck to replace that. So that's my last tip for you. And we will see you next time. Stay safe, be healthy.